Human blood. Human blood is an essential and complex fluid that sustains life by performing various critical functions. This remarkable substance is integral to the body's survival, as it delivers oxygen and nutrients to cells, removes waste products, fights infections, and regulates body temperature. To understand the intricacies of human blood, our research will address the following questions. 1. What is blood? 2. What is the blood composition? 3. What are the blood functions? 4. What is the circulatory system? 5. How is blood produced? 6. What are the blood types? 7. What is hemostasis and clotting? 8. What are blood disorders and diseases? 9. How has this field evolved through time? 10. How is blood stored and transported? 11. What are the ethical considerations in blood research and transfusion? 12. What are the latest advances in blood research? 13. How do blood functions differ across species? 14. What role does blood play in the immune system? 15. How does blood circulation change with age? Let's start first with what is blood and what is its composition. What is blood? Blood is a specialized body fluid that performs several critical functions to ensure the body's proper functioning. It is composed of various cells and components suspended in a liquid called plasma. Blood circulates through the blood vessels, driven by the heart, and reaches every part of the body to deliver essential substances and remove waste products. It plays a crucial role in transporting oxygen and nutrients, regulating body temperature, and protecting against infections and diseases. What is the blood composition? Blood consists of 4 main components, each with specific roles. 1. Red blood cells, RBCs, also known as erythrocytes, make up about 45% of the blood volume. Contain hemoglobin, a protein that binds oxygen and gives blood its red color. Main function: transport oxygen from the lungs to the body's tissues and return carbon dioxide from the tissues to the lungs for exhalation. 2. White blood cells, WBCs, also known as leukocytes, make up less than 1% of the blood volume but are crucial for the immune system. Types of WBCs include neutrophils, lymphocytes, monocytes, eosinophils, and basophils. Main function: protect the body against infections, foreign invaders, and disease. 3. Platelets, also known as thrombocytes, small cell fragments that play a key role in blood clotting. Main function: help form blood clots to stop bleeding and promote wound healing. 4. Plasma, the liquid component of blood, making up about 55% of its volume. Composed of water, about 90%, proteins, electrolytes, hormones, nutrients, and waste products. Main function: serve as a medium for transporting nutrients, hormones, and waste products throughout the body. These components work together to ensure that blood performs its vital functions efficiently, maintaining the health and stability of the body. Now that we've covered what blood is and its composition, let's explore the crucial roles that blood plays in maintaining our body's health and stability. What are the blood functions? Blood performs several vital functions essential for life. 1. Transportation. Oxygen and carbon dioxide. Red blood cells transport oxygen from the lungs to the body's tissues and carry carbon dioxide back to the lungs for exhalation. Nutrients. Blood carries nutrients from the digestive system to cells throughout the body. Waste products. Blood transports waste products to the kidneys and liver for excretion. Hormones. Blood circulates hormones from the endocrine glands to target organs, regulating various bodily functions. 2. Regulation. Body temperature. Blood helps regulate body temperature by distributing heat throughout the body and releasing excess heat through the skin. pH balance. Blood maintains the pH balance of bodily fluids, ensuring that enzymes and other biochemical processes function optimally. Fluid balance. Blood regulates the balance of water and electrolytes in the body, maintaining proper hydration and electrolyte levels. 3. Protection. Immune defense. White blood cells and antibodies in the blood protect the body against infections and foreign invaders. Clotting mechanism. Platelets and clotting factors in the blood help stop bleeding and promote wound healing through a process called hemostasis. Understanding these functions highlights the indispensable role of blood in sustaining life and health. With this foundation, we can now delve into the circulatory system and how blood moves through the body. Now that we have a solid understanding of blood and its functions, let's explore the circulatory system, which serves as the transportation network for blood throughout the body. What is the circulatory system? The circulatory system, also known as the cardiovascular system, is a complex network of the heart, blood vessels, and blood that works together to maintain the flow of blood, nutrients, oxygen, and waste products to and from the body's tissues. This system is vital for sustaining life, ensuring that every cell receives the substances it needs to function properly. Now let's explore about how blood is produced in the body. How is blood produced? Blood production, or hematopoiesis, primarily takes place in the bone marrow, a spongy tissue found inside certain bones. This complex process involves the differentiation and maturation of stem cells into various types of blood cells. Hematopoiesis, the process of blood production. 1. Stem cells, the origin. All blood cells originate from multipotent hematopoietic stem cells, HSCs, found in the bone marrow. These stem cells have the ability to differentiate into all types of blood cells, making them crucial for blood production. 2. Differentiation, pathways to blood cells. Hematopoietic stem cells differentiate into two main lineages, myeloid and lymphoid. Myeloid lineage, this pathway gives rise to red blood cells, platelets, and certain types of white blood cells, e.g., neutrophils, basophils, eosinophils, monocytes. Lymphoid lineage, this pathway produces lymphocytes, including T cells, B cells, and natural killer, NK, cells. 3. Maturation, forming functional blood cells. As stem cells differentiate, they undergo various stages of maturation, becoming specialized blood cells with specific functions. Red blood cells lose their nucleus and take on a biconcave shape to efficiently carry oxygen. Platelets are formed from large cells called megakaryocytes, which fragment into smaller pieces. White blood cells develop into their respective types, each with unique roles in immune defense. 4. Regulation, ensuring balance. The body tightly regulates hematopoiesis to maintain a balance of blood cells. Signals from hormones, growth factors, and cytokines guide the differentiation and proliferation of stem cells. Erythropoietin, EPO, is a key hormone that stimulates the production of red blood cells in response to low oxygen levels. Understanding hematopoiesis provides insight into how the body continually replenishes its blood supply, ensuring that the circulatory system functions effectively. Let's delve to explore the blood types. What are the blood types? Blood types are classifications of blood based on the presence or absence of specific antigens on the surface of red blood cells. These antigens are inherited from our parents and play a crucial role in determining compatibility for blood transfusions and organ transplants. The ABO blood group system. The ABO blood group system is the most well-known and consists of four main blood types. 1. Type A has A antigens on the surface of red blood cells and anti-B antibodies in the plasma. 2. Type B has B antigens on the surface of red blood cells and anti-A antibodies in the plasma. 3. Type AB has both A and B antigens on the surface of red blood cells and no anti-A or anti-B antibodies in the plasma. Type AB is known as the universal recipient. 4. Type O has no A or B antigens on the surface of red blood cells and both anti-A and anti-B antibodies in the plasma. Type O is known as the universal donor. The Rh factor. Another important antigen is the Rh factor, rhesus factor, which can be either present, plus, or absent. This leads to 8 possible blood types: A+, A, B+, B, AB+, AB, O+, and O. Rh positive, Rh plus the presence of the Rh antigen on the surface of red blood cells. Rh negative, Rh the absence of the Rh antigen on the surface of red blood cells. Importance of blood typing. Blood typing is crucial for safe blood transfusions and organ transplants. Receiving blood with incompatible antigens can trigger an immune response, leading to severe complications. Universal donors and recipients, type O individuals can donate blood to any blood type, universal donors, while type AB+ individuals can receive blood from any blood type, universal recipients. Understanding blood types and their compatibility is essential for medical practices such as blood transfusions, organ transplants, and pregnancy care. Now, let's discover the hemostasis and clotting. Hemostasis is the process by which the body stops bleeding and begins the healing process after a blood vessel is injured. This crucial mechanism ensures that we do not lose excessive blood and allows for wound repair. Hemostasis involves three primary steps: vasoconstriction, platelet plug formation, and the coagulation cascade, which leads to clotting. Steps of hemostasis. 1. Vasoconstriction. When a blood vessel is damaged, it constricts to reduce blood flow to the injured area. This initial response, known as vasoconstriction, helps minimize blood loss. 2. Platelet plug formation. Platelets, small cell fragments in the blood, quickly adhere to the exposed collagen fibers at the injury site. The platelets release chemicals that attract more platelets, forming a temporary plug to cover the break in the vessel wall. This process is called platelet aggregation. 3. Coagulation cascade. The coagulation cascade is a series of enzymatic reactions involving clotting factors in the blood. These factors work together to convert fibrinogen, a soluble protein, into fibrin, an insoluble protein that forms a mesh over the platelet plug. This fibrin mesh strengthens and stabilizes the clot, creating a more permanent barrier to prevent further bleeding. Clotting, coagulation. Clotting, or coagulation, is the process by which blood changes from a liquid to a gel, forming a blood clot. It involves a complex cascade of events, often referred to as the coagulation cascade, that culminates in the formation of a fibrin clot. There are two main pathways that initiate the coagulation cascade: the intrinsic pathway and the extrinsic pathway, both of which converge at a common pathway. 1. Intrinsic pathway. Triggered by damage to the blood vessel and exposure of blood to collagen. Involves clotting factors found within the blood. 2. Extrinsic pathway. Initiated by external trauma that causes blood to escape from the vessel. Involves a clotting factor called tissue factor, TF, released by damaged tissues. 3. Common pathway. Both pathways lead to the activation of factor X, which converts prothrombin to thrombin. Thrombin then converts fibrinogen to fibrin, creating the fibrin mesh that solidifies the clot. Once the injury is healed, the body breaks down and removes the clot through a process called fibrinolysis. This ensures that blood flow can return to normal and prevents excessive clot formation that could lead to conditions like thrombosis. Having understood the process of hemostasis and clotting, let's now explore the various disorders and diseases that can affect blood, emphasizing the importance of maintaining healthy blood components. What are blood disorders and diseases? Blood disorders and diseases encompass a wide range of conditions that impact the components and functions of blood. These disorders can affect red blood cells, white blood cells, platelets, and plasma, leading to various health issues. Here are some common blood disorders and diseases. 1. Anemia. Characterized by a deficiency of red blood cells or hemoglobin. Causes: nutritional deficiencies, iron, vitamin B12, folate, chronic diseases, genetic conditions, sickle cell anemia, thalassemia. Symptoms: fatigue, weakness, shortness of breath, pale skin. 2. Leukemia. A type of cancer that affects white blood cells, leading to their uncontrolled proliferation. Types: acute lymphoblastic leukemia, or acute myeloid leukemia, AML, chronic lymphocytic leukemia, CLL, chronic myeloid leukemia, CML. Symptoms: frequent infections, fatigue, bleeding or bruising, weight loss. 3. Lymphoma. A type of cancer that originates in the lymphatic system, affecting lymphocytes, a type of white blood cell. Types: Hodgkin lymphoma, non-Hodgkin lymphoma. Symptoms: swollen lymph nodes, fatigue, fever, night sweats, weight loss. 4. Thrombocytopenia, a condition characterized by a low platelet count, leading to increased bleeding and bruising. Causes: bone marrow disorders, autoimmune diseases, certain medications, viral infections. Symptoms: easy bruising, prolonged bleeding, petechiae, small red spots on the skin, nosebleeds. 5. Hemophilia, a genetic disorder that impairs the blood's ability to clot due to a deficiency in clotting factors. Types: hemophilia A, deficiency of factor 8, hemophilia B, deficiency of factor 9. Symptoms: excessive bleeding from injuries, spontaneous bleeding into joints and muscles, prolonged bleeding after surgery. 6. Sickle cell disease, a genetic disorder in which red blood cells become abnormally shaped, sickle-shaped, leading to blockages in blood vessels. Symptoms: painful episodes, crises, anemia, frequent infections, delayed growth, vision problems. 7. Multiple myeloma, a type of cancer that affects plasma cells, a type of white blood cell, in the bone marrow. Symptoms: bone pain, fractures, fatigue, frequent infections, high calcium levels. 8. Thrombosis, the formation of abnormal blood clots within blood vessels, which can obstruct blood flow. Types: deep vein thrombosis, DVT, pulmonary embolism, PE. Symptoms: swelling, pain, redness in the affected area, DVT, shortness of breath, chest pain, PE. Understanding these blood disorders and diseases is crucial for early diagnosis, effective treatment, and improving patient outcomes. Awareness and research in this field continue to advance our knowledge and lead to better therapies. How is blood stored and transported? Proper storage and transportation of blood and its components are crucial to ensure their safety and effectiveness for transfusions. Here's a detailed look at how it's done. Blood storage. 1. Red blood cells, RBCs. Storage conditions: RBCs are stored at 1 to 6 degrees Celsius, 34 to 43 degrees Fahrenheit, to maintain their viability. Shelf life: RBCs can typically be stored for up to 42 days when additives are used to enhance their preservation. 2. Platelets. Storage conditions: platelets are stored at room temperature, 20 to 24 degrees Celsius or 68 to 75 degrees Fahrenheit, and require continuous gentle agitation to prevent clumping. Shelf life: platelets have a shelf life of up to 5 days. 3. Plasma. Storage conditions: plasma is usually frozen at -18 degrees Celsius 0 degrees Fahrenheit or colder soon after collection to preserve clotting factors. Shelf life: frozen plasma can be stored for up to 1 year. 4. Cryoprecipitate. Storage conditions: cryoprecipitate, a component rich in clotting factors, is stored frozen at -18 degrees Celsius 0 degrees Fahrenheit or colder. Shelf life: it can be stored for up to 1 year. Blood transportation. 1. Temperature control. Blood components must be transported at specific temperatures to maintain their quality. Refrigerated RBCs, transported in insulated containers with ice packs to keep them at 1 to 6 degrees Celsius. Platelets. Transported at room temperature in containers that allow for gentle agitation. Frozen plasma and cryoprecipitate, transported using dry ice or specialized freezers to maintain temperatures at -18 degrees Celsius or colder. 2. Regulatory compliance. Blood transportation follows strict regulations and guidelines set by organizations such as the World Health Organization, WHO, the American Association of Blood Banks, AABB, and local health authorities. These guidelines ensure that blood products remain safe and effective throughout the transportation process. 3. Documentation and tracking. Proper documentation and tracking systems are in place to monitor the transportation of blood products. This includes maintaining records of temperature logs, transit times, and chain of custody to ensure traceability. 4. Quality assurance. Blood banks and healthcare facilities implement quality assurance measures to ensure that blood products meet safety and efficacy standards. This includes regular testing and inspections to verify that storage and transportation conditions are consistently maintained. By adhering to these stringent storage and transportation protocols, blood banks and healthcare facilities ensure that blood products are safe and effective for patients in need. Now that we have discussed the storage and transportation of blood, let's explore how blood functions differ across various species, offering a fascinating glimpse into the diversity of life. How do blood functions differ across species? Blood functions across species exhibit remarkable diversity, reflecting adaptations to different environments, lifestyles, and physiological needs. Here are some key differences. 1. Oxygen transport. Humans, hemoglobin in red blood cells binds oxygen for transport. Many fish have hemoglobin with a higher affinity for oxygen, adapting to lower oxygen levels in water. Insects, instead of hemoglobin, insects have hemolymph, a fluid that lacks red blood cells and directly bathes tissues. 2. Circulatory systems. Humans and mammals possess a closed circulatory system with a heart and blood vessels. Insects have an open circulatory system where hemolymph flows freely within body cavities. Fish feature a single circulatory loop, where blood passes through the heart once during each circuit. 3. Immune response. Humans and mammals have a complex immune system with various white blood cells, antibodies, and other defense mechanisms. Amphibians possess a simpler immune system but can regenerate certain tissues, including parts of the heart. Invertebrates rely on innate immunity, lacking the adaptive immune system found in vertebrates. 4. Temperature regulation. Humans and mammals use blood to regulate body temperature through vasodilation and vasoconstriction. Reptiles' blood temperature varies with the environment, as they are ectothermic, cold-blooded. Birds have a high metabolic rate and use blood to dissipate excess heat through specialized structures. 5. Hemoglobin variance. Humans' hemoglobin is the primary oxygen-carrying molecule. High-altitude animals, some animals, like llamas, have hemoglobin with a higher oxygen affinity to cope with low oxygen levels at high altitudes. Some Arctic fish produce antifreeze proteins in their blood to prevent ice formation. 6. Blood clotting. Humans and mammals, complex coagulation cascade involving platelets and clotting factors. Birds and reptiles, similar clotting mechanisms but with some differences in clotting factors. In vertebrates, clotting involves different mechanisms and molecules, adapted to their specific physiology. What role does blood play in the immune system? Blood is a fundamental component of the immune system, serving as the primary medium through which immune cells and molecules travel throughout the body to defend against infections, pathogens, and foreign invaders. Here are the key ways blood contributes to the immune response. 1. White blood cells, WBCs. Types of WBCs. Blood contains various types of white blood cells, each with specific roles in immune defense. These include neutrophils, lymphocytes, T cells and B cells, monocytes, eosinophils, and basophils. Neutrophils. These are the most abundant type of white blood cells and act as the first line of defense by engulfing and destroying pathogens through a process called phagocytosis. Lymphocytes, T cells and B cells are crucial for adaptive immunity. T cells help identify and destroy infected cells, while B cells produce antibodies that target specific antigens. Monocytes. These cells differentiate into macrophages and dendritic cells, which also perform phagocytosis and present antigens to T cells to activate the immune response. Eosinophils and basophils. These cells are involved in the defense against parasitic infections and play roles in allergic reactions. 2. Antibodies. Function. Blood contains antibodies, also known as immunoglobulins, which are proteins produced by B cells in response to specific antigens. Antibodies bind to antigens, neutralizing pathogens, marking them for destruction, or preventing their entry into cells. 3. Complement system. Role. The complement system is a group of proteins in the blood that enhances the ability of antibodies and phagocytic cells to clear microbes and damaged cells. It promotes inflammation and helps destroy pathogens. 4. Cytokines. Communication. Cytokines are signaling molecules that facilitate communication between immune cells. They are released by white blood cells and other cells to regulate the intensity and duration of the immune response. 5. Inflammatory response. Mechanism: when tissues are injured or infected, blood delivers white blood cells, antibodies, and other immune components to the affected area, leading to inflammation. This response helps isolate the threat and promotes healing. 6. Immune surveillance. Patrolling: blood continuously circulates immune cells throughout the body, allowing them to monitor for signs of infection or abnormal cell growth, such as cancer. This process is known as immune surveillance. By serving as the transport system for immune cells and molecules, blood plays an indispensable role in detecting, responding to, and eliminating threats, thereby maintaining the body's health and preventing disease. Having understood the crucial role of blood in the immune system, let's explore how blood circulation changes as we age. How does blood circulation change with age? As we age, several physiological changes occur in the cardiovascular system, impacting blood circulation. These changes can affect the efficiency of blood flow and contribute to various age-related health issues. 1. Decreased elasticity of blood vessels. Arterial stiffness: the walls of arteries become less elastic and stiffer with age, a condition known as arteriosclerosis. This reduces the ability of blood vessels to expand and contract, leading to increased blood pressure and reduced blood flow. 2. Reduced cardiac output. Heart function: the heart's ability to pump blood efficiently decreases with age due to factors such as a decline in heart muscle strength and the thickening of heart walls. This results in reduced cardiac output, meaning less blood is pumped with each heartbeat. 3. Increased blood pressure. Hypertension: age-related changes in blood vessel elasticity and increased resistance in the arterial system often lead to higher blood pressure. Hypertension can strain the heart and blood vessels, increasing the risk of cardiovascular diseases. 4. Impaired blood flow regulation. Vasodilation and vasoconstriction: the body's ability to regulate blood flow through vasodilation, widening of blood vessels, and vasoconstriction, narrowing of blood vessels, diminishes with age. This can affect the delivery of oxygen and nutrients to tissues, especially during physical activity. 5. Changes in blood composition. Blood cells and plasma. There may be changes in the composition of blood cells and plasma with age, including a reduction in the number of red blood cells, which can affect oxygen transport. Additionally, the balance of electrolytes and proteins in plasma can be altered, impacting overall blood function. 6. Increased risk of blood clots. Coagulation changes: age-related changes in the coagulation system can increase the risk of blood clots, thrombosis. This is due to alterations in clotting factors and a decrease in the effectiveness of anticoagulant mechanisms. 7. Slower healing and repair. Wound healing: reduced blood flow and changes in the immune response can lead to slower wound healing and repair processes in older adults. This can result in a higher susceptibility to infections and prolonged recovery times. Understanding these changes in blood circulation with age is essential for managing age-related health issues and promoting cardiovascular health in older adults. In conclusion, blood is a remarkable and complex fluid that plays a vital role in sustaining life through its various functions. From transporting oxygen and nutrients to fighting infections and regulating body temperature, blood is indispensable to our overall health. Understanding the different components of blood, how it is produced, stored, and transported, and how its functions vary across species provides us with valuable insights into its importance. We have also explored the significant advancements in blood research, highlighting the progress made in gene editing, personalized medicine, and the development of artificial blood, among others. The ethical considerations in blood research and transfusion ensure that the safety, dignity, and rights of both donors and recipients are protected. Finally, recognizing how blood circulation changes with age and the role of blood in the immune system underscores the need for continued research and innovation to address age-related health issues and enhance our understanding of the immune response. As we continue to delve deeper into the mysteries of blood, the future holds even more exciting possibilities for improving human health and advancing medical science. In conclusion, blood is a remarkable and complex fluid that plays a vital role in sustaining life through its various functions. From transporting oxygen and nutrients to fighting infections and regulating body temperature, blood is indispensable to our overall health. Understanding the different components of blood, how it is produced, stored, and transported, and how its functions vary across species provides us with valuable insights into its importance. We have also explored the significant advancements in blood research, highlighting the progress made in gene editing, personalized medicine, and the development of artificial blood, among others. The ethical considerations in blood research and transfusion ensure that the safety, dignity, and rights of both donors and recipients are protected. Finally, recognizing how blood circulation changes with age and the role of blood in the immune system underscores the need for continued research and innovation to address age-related health issues and enhance our understanding of the immune response. As we continue to delve deeper into the mysteries of blood, the future holds even more exciting possibilities for improving human health and advancing medical science. Please remember to subscribe, like the video, and share it with your friends. Your support is greatly appreciated.